Hello, welcome to the Breathing and Sleep Center. My name is Dr. Kevin Goles, and we're going to be reviewing a lot of really important information today to get you prepared for your appointment with the doctor, to review your case and figure out what's going to be the best treatment options for you moving forward to maximize your quality of life. And if we're going to maximize your quality of life, maximizing your quality of sleep is one of the most important things we can do. When we look at our overall health, we think about all these different things that are going to affect it, like your diet and exercise. And when we work with functional medicine doctors, they're looking at adrenal issues and leaky gut problems and toxins that you've been exposed to. All of those pillars, the foundation to that is going to be your quality of sleep. So if you're not getting good quality of sleep, nothing else can really function and perform like it's supposed to within your body and your brain. So when we look at all these different symptoms that are out there, such as like snoring or a deviated septum or nasal congestion, to things that are a little bit more serious, like depression and anxiety, to things that are even more serious, like stroke and heart attacks, cancer and dementia. All these things that seem so different can be linked down to similar root cause, and it's your quality of breathing, and most importantly, your quality of sleeping throughout the night. So when we look at your quality of sleep, there are two restorative stages that we want to maximize. It's your REM stage and your deep stage of sleep. So in deep sleep, it's actually different from your REM cycle. That is your body's restorative sleep. So in deep sleep, you are perfecting your hormones throughout your body. You're secreting testosterone and growth hormone and other hormones that are going to be really important for weight management and every other aspect of your body. If you're not getting good quality deep sleep, you're not going to be producing that testosterone or that growth hormone or any other hormone that's going to be important for your health. Also in deep sleep, it's when we get this reboot of the cardiovascular system where your heart rate drops and your blood pressure goes down. If you're not getting good quality deep sleep, you're not getting that reboot of the cardiovascular system, and now your heart's always in overdrive, which is going to lead to higher blood pressures during the daytime. So the best blood pressure medication you can have is deep sleep. In addition to that, deep sleep is going to be really important for your metabolic health, specifically your blood sugar. So in deep sleep, your body is perfecting the amount of insulin that the pancreas secretes, and it makes the cells receptive to that insulin. Those cells are going to be pulling the blood sugars out of the blood to help manage your blood sugar levels. If you're not getting good quality deep sleep, then your body is not going to produce enough insulin, and the cells are not going to be responsive to that insulin as well to pull the sugars out of the blood, which will lead to higher blood sugar and higher risk of prediabetes and diabetes. There have actually been a lot of studies conducted that show that if you're getting 6 hours of sleep or less for 3 nights in a row, everybody's going to either turn pre-diabetic or diabetic, no matter who you are. So the most important thing you can do for blood sugar regulation is get good quality deep stage sleep. And also this is going to lead to a higher risk of Alzheimer's and dementia if you're not getting good quality deep sleep. So Alzheimer's and dementia is essentially a type 3 diabetes, where the brain cells and the neurons are not pulling these toxic proteins out of the brain. Those are called beta amyloid and tau proteins. Those proteins, the more they build up in your brain, the higher risk you have for Alzheimer's and dementia. But deep sleep will actually turn on this glymphatic system that will drain these toxic proteins out of the brain and reduce your risk of Alzheimer's and dementia. So making sure we're getting quality deep sleep is going to be really important for neurocognitive decline, especially in our later years. Deep sleep is also going to help with our memory consolidation. It's going to take things from our short-term memory and move them into our long-term memory. If we're not getting good, adequate deep sleep, that short-term memory becomes waterlogged, if you will, and you can't get more information into that short-term memory. And those other memories are going to get pushed out, and you're going to actually lose the memory and the things that you've learned the day before. So deep sleep is really important for the ability to learn and move things to long-term memory. The other aspect of restorative sleep is our REM cycle. This is going to be our brain's restorative sleep. So in REM sleep, we are going to be dreaming and going through all the restorative aspects for our brain. So REM sleep is going to be really important for mood with anxiety and depression. It's going to be really important for learning and cognition. It's also what's going to be responsible for our mental acuity. And if we're not getting good quality REM sleep, that's going to lead into brain fog and grogginess. REM sleep is also really important for taking the edges off of traumatic events. A lot of people have heard of EMDR for PTSD and depression, and it's essentially where your eyes are crossing the midline and you're touching back and forth with your body and with your eyes. And REM sleep is essentially natural EMDR for that kind of therapy. So I joke that it's not that time heals all wounds, it's actually REM sleep that heals all wounds. But in REM sleep, our brain activity is very similar to us being awake. So in order for us not to act out our crazy dreams, our body goes paralyzed during REM sleep. And in that paralyzed state, all those muscles around the airway can collapse into it and block that airway off in our REM cycle. So the way we keep that airway open in REM sleep is our tongue should be suctioning up against the roof of the mouth to stay out of the airway. If we don't have enough space for that tongue, or we're mouth breathing, then everything's gonna fall back into our airway and block it off. And so then we have to find a way to compensate. We either start to lose oxygen, or we'll clench our jaw to bring our jaw forward to open up our airway during that REM cycle of sleep as well. This will then lead to us waking ourselves up out of REM sleep and putting ourselves into a fight or flight response as we're clenching and grinding at night. So the nighttime clenching and grinding for kids and adults is actually a sign of an airway problem and an airway collapse as we're sleeping in REM. So when I look at someone's quality of life, what I want to make sure we're maximizing is our REM and our deep stages of sleep. That is the most important thing that we can do to maximize our quality of life. We should be going through around 4 to 6 sleep cycles per night, where we drop into light sleep, drop into deep sleep, and come back up into REM, and doing that 4 to 6 times per night. Each cycle is about an hour and a half to 2 hours long. And so I want to make sure that you can keep your airway open during those cycles so you don't wake yourself up out of deep sleep or lose oxygen or have to find a way to compensate to where your body is choosing to breathe over sleep. I want your body to do both. I want it to be able to breathe and get oxygen to the lungs and to the brain while also maximizing our restorative stages of sleep. Because like I said before, there's not a single cell in our brain or our body that isn't negatively affected when we're not getting good quality sleep. When we think about sleep apnea, typically we think about going into an in-lab study where you have 40 wires connected to you with cameras staring at you in a very odd environment in a hospital. We typically want to do your sleep study at home in your own bed so we can see what your actual sleep is like every night in your own home. That's going to help us figure out what we need to do to maximize your quality of sleep. And unfortunately, the old standard for sleep apnea treatment is a CPAP, which is a mask that goes over your face and forces air down your throat. However, the compliance of that is pretty low, around 20% depending upon the study that you look at. But we want to make sure that we're maximizing your sleep quality, and I halfway joke that the way that CPAP fixes your sleep apnea is it doesn't let you sleep. It's so fragmenting to your sleep that you're actually always in this aroused or lighter stage or waking yourself up, and that's going to make it to where you have enough tone to maintain your airway. So ideally, I want to make it to where you can keep your airway open and maximize your sleep stages without having to wake yourself up or fragment your sleep with something like a CPAP. So we're here to maximize your quality of sleep and not just force air to your lungs. Unfortunately, sleep apnea is typically a progressive disease in nature anyways, and the CPAP has been known to exacerbate that progression. It actually has an effect to where it can make your airway smaller over time, make your breathing lazier, and it can actually make the problem worse. So here at the Breathing and Sleep Center, we're gonna get to the root cause and ideally get you off of a CPAP if you're on one, or prevent you from needing one in the first place. So if someone could not tolerate a CPAP, yet they still had a lot of sleeping and breathing issues, the other alternatives were a lot more invasive. A surgeon could break your jaw and bring your jaw forward and wire you shut for 6 weeks, or another surgeon could go in there and cut out the back of your throat to where it's almost like you're swallowing razor blades for 3 weeks, and that could actually still create a lot of other issues down the road. Or you could do another surgery where they place a neurostimulator in your chest that runs a wire up to your tongue and shocks your tongue forward and to the side. You're like a drunk lizard. So that procedure is called Inspire. And unfortunately, that has been recalled recently as well because of electrical leaking to making it to where it's not effective. And even if it is working properly, studies have shown that majority of patients are not even turning it on because of the complications with that type of treatment. The other problem with that is that patients are having to get the surgery done every 5 to 7 years to replace that battery. So not only is it extremely expensive, but you're having to do the surgeries multiple times to fix this battery of this neurostimulator. If you didn't want to do something invasive, then that's where a dentist would typically just give you an appliance that holds your jaw forward. It's called a mandibular advancement device. But the problem with those appliances is they're only maintaining the airway that you already have. So if you're breathing out of a coffee straw, that oral appliance will just be maintaining that coffee straw, and it's still going to be very difficult to get oxygen to your lungs. These appliances are also notorious for creating a bite issue. So when you wear this all night long, you'll wake up and your jaw's in a different position to where it's hard for your teeth to fit together, and it can affect your ability to chew. My residency research was focused on these appliances, but there is limited effectiveness when it comes to these appliances, which is why we look at other aspects to actually get to the root cause of your breathing and sleep issues, to where ideally you don't need any of this and you can maintain your own airway by yourself without any kind of interventions when we're done with you. In order for this to happen, if we want to get to the root cause of your breathing and sleep problems, there are 3 things that we need to maximize. So like we talked about before, we are maximizing your quality of sleep with your REM and deep stage sleep. So as you're going through those sleep cycles, if you can't maintain your airway, then your body is either gonna have to wake itself up to breathe at the expense of your sleep quality, or you'll start to drop oxygen, which is the most important thing for our body to utilize to stay alive. So I wanna make sure you go through that sleep cycle without needing to compensate and making sure we can maximize those sleep cycles without any kind of disruption. In order for that to happen, there's 3 boxes that need to be checked. The first thing is I need to make sure you have a big enough airway to breathe out of. If you are breathing out of a coffee straw, you're kind of doomed no matter what, okay? But I still have kids and adults that still have big airways that still have severe obstructive sleep apnea, and that's because they can't maintain that big airway when they're sleeping. And that's because the second box isn't checked, which is enough space for your tongue. So we need a big enough airway and we need enough space for your tongue, because if there's not enough space for your tongue to suction up against the roof of the mouth to stay out of the airway during sleep, it's gonna fall back and block your airway. And then you have to find a way to compensate. The third thing that needs to happen as well is we have to have the proper muscle function to keep your tongue out of that airway. So if you have an untreated tongue tie that's pulling your tongue down and back into the airway, that can also block off your airway. Or if you can't breathe out of your nose and you become a mouth breather, then that's when everything's gonna fall back into your airway as well. Okay, so in order for you to maintain that airway during sleep, to maximize your sleep stages, we need to make sure you have a big enough airway, enough space for the tongue, and the proper muscle function. If any one of those 3 boxes aren't checked, you're gonna have an airway collapse and you have to find a way to compensate throughout the night. And it can present in so many different aspects. So when we look at your case, those are the 3 things we're gonna be focusing on to make sure you can maintain your airway and maximize your sleep quality and maximize your quality of life. So if you have an airway like this, where you're breathing more out of a coffee straw, it's gonna be a lot more difficult to be able to maintain this as you're sleeping. So this is a side profile of someone's head. You can see on the right side where their nose and lips and chin are, and the left side is the back of their head. So that black area is where the air is supposed to be going through behind your soft palate and behind your tongue to get to your lungs. The smaller that tube is, the harder it is to get air to your lungs. So whatever I can do to maximize this airway, the easier it is gonna be able to maintain that airway and maximize your sleep cycles. So here's another image that shows this small airway that someone's breathing out of. We wanna make sure that they have a big enough airway to breathe out of, where this person, it doesn't even matter if they have enough space for their tongue or the proper muscle function, there's not an airway that we can even maintain. This is a great picture that we utilize to see if you have enough space for your tongue. So you can see the side part of the tongue does not fit into that upper part of the roof of the mouth. So this picture shows that someone has like an F-250 tongue with a garage that can only fit a smart car. Which means then, if they try to go to sleep, that tongue does not have enough space to suction up against the roof of the mouth, and it's gonna fall back into their airway and block that off while they're sleeping. Then the third thing is to see if you have proper muscle function, specifically the tongue. If your tongue cannot suction up against the roof of the mouth because it's very restricted, that's gonna pull that tongue down and back into your airway while you're sleeping as well. So these are the 3 boxes we're gonna be looking at for your case to see what we need to fix to maximize your quality of sleep. So when we're looking at those 3 pillars, when it comes to the size of your airway, space for your tongue, and the proper muscle function, there's a lot of different tools we can utilize to maximize those. However, through all of our experience and research, we have found the most non-invasive yet most effective way to address your breathing and sleep. And one of those appliances is going to be called a Vivos appliance, which is known as an mRNA or a DNA appliance. There are different versions of a similar process. And this appliance has actually been FDA approved for severe sleep apnea, which is the first of its kind. And here at the Breathing and Sleep Center, we have done the most of these in the world. So not everyone knows exactly how to use these appliances, but you know that you'll be in the best hands with us to maximize your results and maximize your quality of life through this kind of appliance. So thankfully, surgery and CPAP isn't your only option. And actually, this might be a much better option to maximize the things we're trying to improve, which is your quality of life. Another way we can kind of go about this process is through a clear aligner. However, not all clear aligners are the same. Typically, people think of Invisalign when they think of a clear aligner. However, how we use these clear aligners is really important. We want to make sure we're taking the teeth and the jaws and expanding them forward and wider, which is going to give you a bigger airway instead of retractive. We don't want to bring your jaws and your teeth in and back because that will take up more tongue space and will create a smaller airway. So when I go back to the size of your airway is a tube that goes down your throat. And that tube is surrounded by soft tissue, and that soft tissue is supported by your jaw bones. So the size of your jaw bones have a direct effect on the size of your airway. If your jaws are narrow and held back, it's going to make it to where you're breathing more out of a coffee straw instead of a garden hose. At the same time, if your jaws are narrow and held back, it's going to create a lot less space for your tongue, so your tongue cannot stay out of your airway, and it's a lot more likely to fall back into that airway, especially during sleep. And the third thing is if your jaws are narrow and held back, you're going to have a lot less space for your teeth. So as kids, as your teeth erupt into your mouth, there's not going to be enough space and they become crowded. And then you'll not have enough space for your wisdom teeth either. So when they try to come in, they actually go in sideways and become impacted. And that's when you have to have those removed. So the size of your jaw bones actually have a direct effect on the size of your airway. And our main goal here at the Breathing and Sleep Center is to maximize the size of your jaw, which is going to maximize the size of your airway and space for the tongue. So everything we do is an expansion type manner where we are focusing on function and breathing and sleep. And the cool side effect is we're also straightening your teeth at the same time. A really important aspect of these clear aligner systems is we are doing it in a way that is expansive, which we don't typically have to use any buttons or attachments on your teeth because those can be used to pull your teeth inwards. And we don't ever shave between your teeth to make your teeth smaller, to make enough space for your teeth so they can be straight. We want to make it to where your teeth are straight from expanding the jaw bones, which like I said is creating a bigger airway space and a bigger tongue space. So it's a lot easier to wear our aligners because they're a lot more comfortable, a lot easier to speak with, and people can't even tell that you're wearing them because of how discreet they actually are. So we don't want those buttons on the right side. We want it to be nice and clear where there's nothing on your teeth like you see on that left side. The cool thing is if we're gonna use a clear aligner to expand out your jaw bones, we can do this completely remotely. So instead of you coming to our office every 4 to 6 weeks for us to check to see how your progress is going, we can see you every step of the way via remote monitoring with an app on your phone where we can see how your teeth are moving and how they're tracking in the comfort of your own home. So all of this kind of movement and this change and this expansion was done with aligners over 20 weeks without them ever having to come see me at the practice. So pretty massive changes in such a short amount of time that isn't just making the teeth straighter, it's actually improving their quality of life, their ability to breathe, and their quality of sleep. So these are also befores and afters as you look at these clear aligner systems. So this is one tool that we can use to maximize your breathing and sleep. And we utilize this one a lot. It's not the only tool, but just so you guys can see of what we can do with this product in a short amount of time to make some pretty drastic changes. And the cool thing is on the app on your phone, you'll be able to see your own progress with a video like this. So it is pretty amazing what we can do with just a clear aligner system where we're not using bracket and wire and we're not having to do any kind of damage to your teeth. So it's a pretty drastic effect. So when you look at this patient, she had a lot of TMJ problems and headaches. And so as you go, so this is a before image here to an after image here. So this is her facial profile, okay? This is her posture. But then when we look at her teeth, this is her before and after. So here's her before and here's her after. You can see how her arch is expanding with this clear aligner system. So pretty drastic changes with this clear aligner system that is actually giving her more tongue space and a better jaw position, which helps her jaw joints. And so when you see her before and after, you see how much wider her teeth are. Through this process, it had a drastic effect on her quality of life, on her head pain, and her jaw pain. So as she went through this process, she wrote this amazing review of how much this helped her through her quality of life. And if you look at our website, it's not just a 5-star review with a few words. When you go to our reviews, you'll actually see books that people have written about how drastically it's improved their quality of life from not just the sleeping aspect, but from all angles. So I've spent a lot of time on clear aligners, but these clear aligner systems can also drastically improve gum health. So this before and after with a clear aligner, with us fixing the clenching and the grinding and the airway problems, you can see on those 3 front teeth how that gum tissue had actually improved without doing any kind of grafting or surgery. There's a lot of improvements to this expansion process where we can improve the gum health and the teeth health to make sure that you're not always having to have crowns done or gum grafts done or teeth cracked or recession. So these expansion processes are actually going to improve your overall oral health as well as increasing your airway volume and your tongue space. There's a lot of benefits to this expansion process, and we have plenty of befores and afters of showing you what we can do with these aligner systems. But if we're really trying to maximize your quality of life, then this case is going to be perfect to show you some of the other options we have available. So this patient actually had a lot of breathing and sleep issues where he stopped breathing 99 times per hour. He either stopped breathing or lost oxygen 99 times per hour. And he tried CPAP and failed it. And so as he went through this process, he used one of those Vivos appliances that we talked about earlier, one of those mRNA or DNA appliances that is a non-surgical appliance that'll help expand the roof of the mouth and the floor of the nose, as you see in this picture. So on that far left side is where he was at 99 episodes an hour. That middle picture after 5 months, you can see the roof of the mouth, how that was actually expanding and opening up. And that took him to 16 episodes an hour. And then we used a clear aligner to finish his case on that right side to where he went down to 6 episodes an hour. So with this FDA approved severe sleep apnea appliance, we can get some massive changes when it comes to the jaws and the airway. So that left side, 99 episodes an hour. The middle, you can actually see the roof of the mouth that's actually expanding and opening up the nasal volume and the sinuses. This is what this appliance can do that the aligners won't. But we will still use the aligners to fine tune the bite and the aesthetics and the teeth on that very end. So as you see this before and after, pretty amazing results in the span of about 12 months. The crazy thing is he was told from 3 different dentists that he had to have jaw surgery to fix this. And we were able to do all of this without jaw surgery, and we were able to get him off of his CPAP forever. And this is a pretty severe case. So that upper left is where he started. He had a tongue thrust that created an open bite in his front teeth. We expanded everything out. And that upper right picture, I use this as an example. You're not gonna look like that upper right picture. But I also wanna make sure that people that use Vivos appliances also go to a doctor that knows how to finish the case. Because even though he went to 16 episodes an hour on that upper right side and got space for his tongue, we still needed to fix his teeth and his bite. And then we were able to do that with a clear aligner after the span of about 9 months on that bottom picture, to where we can actually still perfect his bite and his aesthetics and actually further improve and cure his sleep apnea. So this is his facial changes as we went through this process. So this Vivos expansion appliance, as you can see where it started on that left side, all the way to that right side, how that facial profile had gone through a transformation over the span of about 1 year, all without surgery. If you can see that left picture, his chin was recessed back and his head was in a forward head position in order to breathe. After the expansion process, you can see in that middle picture that his chin was lined up with his upper lip. And then by that right picture, when he was done with treatment, his lower chin was actually in front of his upper jaw. He had a better posture and he can actually breathe and sleep. So he went from 99 episodes an hour down to 6 and completely changed the quality of his life and his quality of breathing and sleeping. As you can see his posture change here, because he was no longer putting himself in a forward head position to breathe. He actually had an airway to breathe out of and actually could be in a more neutral position. We also did a special treatment called night laze, where we can shrink and tighten the soft palate with a laser therapy that's not cutting anything or creating any scar tissue. It's just stimulating collagen to lift and tighten and shrink the soft palate. This could also be an option for you when we go through your records and treatment options. So when you look at this patient's x-ray, you can see how his airway increased from 6.1 millimeters behind his soft palate to 9.5, and then 8.9 millimeters behind the base of his tongue to 11.4. And the way you measure airflow is radius to the 4th power. So if I can increase that radius even by 1 or 2 millimeters, we can have a drastic effect on the ability to get air to the lungs. So when you look down his airway in these pictures, that left side is where he started and that right side is when he finished. So he went from 238 squared millimeters of airway surface area to 406 squared millimeters of airway surface area. Now behind the base of his tongue, he went from 292 squared millimeters to 485. And you can even see the width of his airway increased by 15 millimeters through that process. So we had a drastic increase of airway size so we can get so much more air to his lungs and actually fix his breathing and sleep issues. The cool thing is, if you look through his nose, this is a picture looking through his face. So that circle on the upper left of that face is his right eyeball. And then on the right side, as you're looking at this picture, is his left eyeball. We're looking through his face. And so you have the sinuses below those eyeballs, his tongue below that, and his back teeth that are sitting there. But if you look right in the middle of the picture, you can see this bone that kind of buckles to his left side, your right. That is considered a deviated septum. And through expanding the roof of the mouth and the floor of the nose, I'm not fixing that deviated septum, but what's happening is I'm getting more air around that deviated septum, so he did not have to have the surgery. So we were still able to fix his nasal breathing and his sinus function and improve his sleep quality without ever having to go through any kind of surgery through the nose or the mouth. So his airway increased by 38%. That picture on the left is where he started to the picture on the right where he finished. As you can see on that picture on the left, his tongue is actually sticking forward to stay out of his airway. So his airway on the left-hand side was even smaller than what that picture is showing you because he was compensating by thrusting his tongue forward to keep it out of his airway. So through this process of expansion, we actually decreased his sleep apnea from 99 episodes an hour down to 6. So it's pretty drastic results. As you can see with his aligner system, without him coming to see us, we can still create a pretty drastic change with his bite with just a regular clear aligner. This is another patient who went through a drastic improvement with a Vivos expansion appliance and clear aligners. As you can see in the before and after, you can see how his jawline drastically improved as we expand the jaws forward and wider to give him a better posture, better tongue space, and a better airway. So crazy changes in the span of about a year for this patient. And as you can see, his airway going from that left side to that right side. That's more of a coffee straw to a much bigger airway on that right side to drastically increase his ability to breathe. Here you can see he went from 4.4 cubic centimeters of airway volume to 11.8. In an ideal world, I'd like to see your airway being around 20 to 25 cubic centimeters of airway volume, and that rarely ever happens. And the smallest part of his airway volume, which is the minimum surface area, went from 31 squared millimeters to 142 squared millimeters. So a much bigger airway volume where he's breathing more out of that garden hose instead of the coffee straw. This is all done non-surgically with no pain and no side effects. Here's another picture with his airway superimposed on his skull. So garden hose versus a coffee straw. You can see his facial changes as he goes through this process as well. And his teeth expand outwards to really create more tongue space and a bigger airway volume. So you can see how his arch actually opened up through this process. Very rarely do I maybe have to create some spacing between the teeth in order to have enough space for the tongue, but that's something we can mitigate and close up at the end of treatment. The more important thing is we improved his quality of life to where he can breathe and sleep so much better. And this is what we're doing with our process without any kind of surgery. So one thing when it comes to the teeth, as I talked about earlier, we do not want our teeth being tipped inwards. We want our teeth to be upright. Because if your teeth are tipping inwards, you're gonna be clenching and grinding your teeth and biting in an oblique angle. And if you're biting and clenching in that oblique angle, you're either gonna flex that tooth to where you start to crack the crown of the tooth and you need to have actually an artificial crown placed, or the tooth will flex so much that it's like a stick in the mud, to where you put a stick in the mud, you push that stick from the side, and it's gonna start to splinter off right at the neck of the tooth. So everything we're gonna be doing is uprighting those teeth, so you're biting down the long axis of the tooth and actually helping with the longevity of your teeth and your gums. At the same time, we're creating more tongue space and a bigger airway volume. And that's what this is showing you right here. These are other before and after airway pictures where we're making it much bigger airway through expansion. So drastic results that are drastically affecting their quality of life. And these are some more before and afters. As you can see, the roof of the mouth actually expanding, and that roof of the mouth is the floor of the nose. So we are opening up your nasal volume with this kind of a process. So these are befores and afters as you go through this both for kids and adults. That has a massive effect on that breathing and the sleeping. The cool thing is through this process, we can really improve the nasal volume and the sinuses. So as we remodel the roof of the mouth and grow the midfacial bone, the bone in your midface, we can actually decompress the sinuses to where the mucus in your sinuses can drain. So these pictures are showing you this mucus that is sitting in these sinuses that actually completely drain as we expand and decompress the mid part of the face. So all of these are befores and afters that show this drastic improvement of the sinuses. So these Vivos appliances have a much bigger effect on these sinuses and nasal volume than if we just did only a clear liner. So I want you to think about this as you're getting ready for your appointment, to think if you need to really maximize nasal volume or sinuses, or if we just need to create more tongue space and a bigger airway volume. So this is the difference between an aligner and a Vivos appliance. The top shows you the roof of the mouth actually expanding and remodeling to create a bigger nasal volume and sinus function, while the picture on the lower is showing you a clear aligner still creating more tongue space and a bigger airway, but we are not doing anything to the roof of the mouth. As you can still see, they have a pretty high vaulted roof of the mouth. So in terms of kids, we can do the same thing for kids as what I just showed you for the adults, but it's a lot easier because these kids are still moldable and are still actively growing. So we can either use some guide appliances that can help guide their growth and development as they are growing, or we can actively expand them with an expander on the upper and the lower. So the way we do expansion for kids is different than what a typical orthodontist would do. If they're not doing an upper and lower expander, they are not focusing on the airway. So if we're gonna be maximizing nasal volume, sinus function, and tongue space, we need to make sure we have an upper and a lower expander for these kids. But with these expanders, with us opening up that roof of the mouth and the floor of the nose, that is actually having a massive change on the ability to breathe out of the nose, which is gonna affect the tonsils and the adenoids. So with this expansion on this kid, you can see how this process is actually gonna be improving his adenoid. So through this expansion, we are going to be opening up the nasal volume and improving sinus function. That's gonna allow these kids to have their tonsils and adenoids shrink and ideally prevent the need for the tonsil and adenoid removal. And if we don't fix this problem, even with their tonsils and adenoids being removed, if they still can't breathe out of the nose, then they're gonna continue to create this problem to where those adenoids could potentially even grow back and need a surgery a second time. So we need to make sure we can maximize nasal volume with this kind of expansion and maximizing their ability to breathe and sleep. So with this expansion for kids and adults, all these pictures are gonna show you how we can drastically improve the airway volume to where you're breathing more out of a garden hose instead of a coffee straw. So all these pictures are here to show you the thousands of cases that we have done non-surgically without pain to maximize your ability to breathe and maximize your ability to sleep and ideally get to the root cause of what's causing so many ailments from the poor quality sleep, from the inability to actually breathe while we're sleeping. So all these are befores and afters, including this guy. You might recognize him. This was my first patient, myself, when I was 28 years old, and I was a top 5% in the world in Ironman triathletes. I wasn't the stereotypical sleep apnea patient where I was middle-aged and overweight with a big neck. But as I went through my expansion process with a Vivos appliance, I actually expanded my upper jaw forward and wider, which allowed my lower jaw to rotate forward, which created a better jawline, but more importantly, a bigger airway. So I was able to cure my own sleep apnea from 24 episodes an hour down to 1. And it's been that way for the past 8 years, ever since I went through my own treatment. So I want the same thing for you. I want to maximize your quality of breathing and your quality of sleep, which is going to maximize your quality of life. After we do the expansion though, I want to make one quick mention of something called myofunctional therapy. So if we expand out your jaw bones, we also need to make sure the muscles can maintain it. Remember, that's the third pillar of your ability to breathe while you're sleeping. So have big enough airway, enough space for the tongue, and the proper muscle function. And so the way we fix the muscle function is through physical therapy through the mouth, called myofunctional therapy. And it's these exercises that are gonna be strengthening the tongue, lip, cheeks, and soft palate muscles that are gonna help you maintain that airway that we have created. So there's 3 important aspects of myofunctional therapy. First, it's gonna help stabilize the expansion that we've created. So a lot of times when someone goes through orthodontics, they don't ever do anything with the muscles. They're not fixing the muscle dysfunction that created the small jaws in the first place, because form of the bone follows function of the muscles. So if you go through orthodontics and your tongue is still sitting low in your mouth and it's not up against the roof like it's supposed to be, then you have this low-grade force of the lips and cheeks over time, pulling everything in and back, which is why you create the relapse when your tongue is not up against the roof of the mouth and it's not maintaining that expansion. The lips and cheeks will win the war and create the relapse to where you have to have braces a second or third time. So the muscles are what's gonna help maintain all this structural change that we're gonna create for you. Secondly, myofunctional therapy is gonna strengthen these muscles so your tongue can suction up against the roof of the mouth to stay out of the airway while you're sleeping. Third, the muscles we're gonna be strengthening with this myofunctional therapy are airway dilating muscles. So the stronger those muscles are, the bigger your airway will actually be as well. So one of our therapists actually stuck a camera down her nose and would do these exercises, and you can see her airway actually dilating as she was doing it. So the stronger that muscle is, the bigger your airway will become. So this is the other half of the equation. We want to fix the structure. We also need to fix the muscle function to be able to maintain that airway that we have created. So going back to this slide, we know that pretty much every cell in our brain and our body is negatively affected if we're not getting good quality sleep. So here at the Breathing and Sleep Center, we're going to be getting to the root cause of what creates all these airway problems and breathing issues that are going to affect your ability to get good quality of sleep, which is going to affect your quality of life. I hope this presentation was informative for you. Please bring any questions you have from this presentation to the doctor so we can review it with your unique case and figure out what's the best treatment options for you to improve your quality of life.